A bone scan is a test which provides a picture. It uses a small measure of radioactive substance called tracer, which locates or monitors cancer which begins within the bones or cancer that has spread to the bones as it started from another part of the body. Bone scans can help to diagnose tumors or cancers such as breast, lung, prostate, thyroid, and kidney. It can help to diagnose fractures, bone infections, and the cause of bone pain. It can help to determine if cancer started somewhere else within the body and evaluate metabolic problem dysfunctions. Advantages: they have the ability to look over the entire human skeleton or selected parts. They can diagnose osteomyelitis 24 hours earlier than plain film. Disadvantages: they're not specific, they need to correlate with plain film radiographs, poor resolution in many places, and they can have difficulty in distinguishing different diseases from one another. To start, the test begins when a physician injects a small amount of radioactive material within the patient's bones. Once injected, the substance travels through the patient's blood and into the bones and organs. Over time, radiation is given to the body in very small amounts. A camera detects the radiation that occurs as it takes pictures of how much the tracer is collected within the patient's bones. The three-phase bone scan is used to detect bone infection. Pictures of the bones will be taken soon after the tracer is in the patient's body and again after 3 to 4 hours. If one wants to look at the metastatic bone disease, they have to take pictures of the bones after 3 to 4 hours the tracer has been put into the body. The hospital will ask for the patient to change into a hospital gown, and it will be required to take off all objects containing metal. If the patient is pregnant, they must inform their doctor, as well as one should not take any medicine which contains bismuth, such as Pepto-Bismol. The patient needs to let their doctor know if they had an X-ray done, which contains barium contrast material. The patient is also encouraged to drink a lot of water, as the radiation should not collect within the bladder, and they will be asked to go to the bathroom before the test. If the bladder is full, it can block the camera's view to the pelvis and cause for wrongful interpretation. Also, doctors may ask the patient to sign a consent form. As the needle is inserted into the patients, they may feel slight pain. However, during the test, no pain is felt. As the testing is going on, the patient must remain still, and this can cause for the patient to feel uncomfortable or discomfort. Normal results. If the test is normal, it means the tracer has moved evenly throughout the bones within the body. The results are classified as normal. Abnormal results. If the test is abnormal, the scan will display hot and cold spots compared to the other bones within the body. A hot spot is when the radioactive tracer has accumulated within the bones. Hot spots can indicate problems such as arthritis and a fracture. Whereas cold spots are bone spots which don't have a lot of the tracer accumulation. Cold spots can display a shortage of blood supply to the bone or certain types of cancer. It is a patient's physician's duty to speak to their patient and discuss any abnormalities that may occur. If the patient is pregnant, doctors do not advise for the developing baby to be exposed to the radiation. Therefore, they postpone the bone scan. If a mother is breastfeeding her child, it is vital that she excretes the milk out of her system for 2 days, ensuring it is not provided to the baby. The radioactive material should not cause much harm, but rashes and swelling can occur. Sunnybrook Research Institute will help to find new treatment plans for cancer and heart disease through new imaging tests. This is possible because of the federal investment ensured by Gary Goodyear. The contribution will help to develop new technologies that will increase the competitiveness of medical imaging, as well as the development will take place in Southern Ontario. Getting a donation of $6.91 million, Sunnybrook Research Institute has partnered with 19 other industries and Western University to commercialize 4 new imaging technologies. The contribution is being given through the FedDev, Ontario's Technology Development Program. This could mean improvement in bone scans as it has a vast scope for development. Not forgetting about the donations being made to the hospitals of Canada throughout the year, this is a chance for our country to expand not only on other parts of the hospitals, but provide more for the bone scan itself. Recently, the philanthropist Emmanuel Gustau and husband donated $50 million to Princess Margaret Hospital. This could mean for improvement in bone scans as they look at cancer within the bones. Through this donation and the continuous donations being made by many, Canada could have a great impact on cancer research, which will lead to the improvement of bone scans itself. This can help not only with cancer within the bones, but also cancer throughout the human anatomy. Bone scans can have two costs associated with it, the technical fee and a specialist taking a look at the test. Bone scans are costly, however, because of PSA, testing has become a little less expensive. Anyone feeling bone discomfort should, however, get a bone scan done. This will help the economy as the government will have to fund less for the bone scan machines and the testing. In Canada, patients have free healthcare, which is why the government pays for a lot of our medical issues. By using the inexpensive way, we can have a lot more money go towards development and research. Tracers used within the bone scans are expensive to develop, as well as imaging tests are not economically friendly. Therefore, the given economic factors, it is better and smarter to develop newer ways to diagnose the same problems. Stakeholders within the political and social factors would be the people of the city as well as the patients within the hospitals. The government is donating a lot of money, which means our taxes might begin to increase. The patients within the hospitals will get to receive procedures that have faster healing times, as well as they will be less invasive, which will cause for less damage to the body. Economically, the stakeholders are the government as they are constantly being affected by the amount of bone scans needed. The more bone scans required, the more the government has to pay, which is why creating newer technology will help the economy and diversify the jobs within our economy as well. To conclude, I would like to thank you for listening, as well as I hope you understood what bone scan machines do and how they help us detect cancer, and the contributions as well as steps that Canada is taking in ensuring that we improve imaging technology. Once again, I thank you for your time.